So there are various reasons to have a joint revision. For a hip replacement, the most common reason to get a joint revision is when it becomes a dislocation, which is when the original ball and socket disassociate and become separate. And that's a painful condition, and patients generally have to come back to the emergency room to have that repositioned. If it becomes a recurring issue, we have to figure out why it happens, and that's when we get into the replacement or the revision to fix what is either incorrectly positioned in the first place or has worn out and led to some instability to cause the dislocation. In terms of a knee replacement, the most common reason to have a revision is actually an infection develops inside of the knee joint. If that should happen, if you catch it soon enough, sometimes you can do a simple procedure to wash everything out and change one of the components and start a course of antibiotics, and that can sometimes be enough to fix the problem. But if it is not caught in time, or if it doesn't get cured with the first procedure, it may involve taking all of the pieces out and taking them back to surgery at another time to put them back in after antibiotics. Unfortunately, joint revisions are more complex. It's usually a bigger procedure, mainly because there's scar tissue that has developed at the site of the surgery. Going back into the same site does often require sometimes a longer incision or a longer surgery time to be able to do the surgery, and sometimes the recovery can be longer as well. In general, it's about 3 months for each of them to have a full recovery. There are different stages that the patients will progress through, starting from the initial hospital phase to the outpatient therapy phase. Everybody progresses at a different pace, but on average it's about a 3-month recovery time. If you're considering a joint revision, it's important to select a surgeon that's comfortable in doing the correct revision. It's not as common of a procedure and often more complex than doing it the first time. Once that's decided, then figuring out the reasons to have the revision is also important in order to correct the problem and cure the patient. Certainly, if people are considering having a joint revision, then there is something going on that's either causing them pain or instability or symptoms where they can't function normally in their day-to-day life. And so I think at that stage, depending on how much they can tolerate what's going on with their joint, they should consider either having the surgery or trying other treatment options to see if they can alleviate their symptoms or pain without a surgery. So starting out, before we even get to the replacement, there are different treatment options in the office, and that entails different medications both by mouth, sometimes injections into the joint, sometimes therapy or bracing options to help with the stability. Once that replacement has occurred, sometimes there are limited options in terms of medications or injections that can be done to correct the problem with the replacement. And more often the revision is necessary because it's a structural problem with the replacement and not a symptomatic problem of the joint itself.